विसवा उपरांत तुमकां येवकार पळोवया फुडल्यो खबरो. विविध तंत्रज्ञानाक लागून खुबश्यो गजाली सोप्यो जाल्यो आसात. तशेंच हॉस्पिटलांनी नव्या तंत्रज्ञानाक लागून मनशाचें जगपूय खूब सोंपें जालां. हालींच्या काळान अव्य ट्रान्सप्लांट करपाच्योय केशी आयकुपाक मेळपाक लागल्यात. गेल्या 2 वर्सांत मणिपाल हॉस्पिटलान 5 हृदय प्रत्यारोपण केल्ल्याची माहिती डॉ. देवानंद NS हांणी दिल्या. RDX गो खातीर पणजेच्यान विलियम रॉड्रिगीस.
That we should create awareness in this particular branch. Now, most of us know that our hearts can fail for various reasons. Some could be related to the birth related defects, some could be multiple valves which will fail, some could be the weakness of the muscle itself right from the birth. We call it as cardiomyopathy. Or it could be sometimes secondary to a very bad heart attack. So there could be infection. Simple viral infection of throat or something sometimes can produce antibodies against our own heart and the heart can fail. Now, in this situation, we have standard methodology of treating these patients. We give them medicines, we have various other things to do with. We have some of the devices which can improve the strength of the heart so that we can survive. Now, there comes a stage in life where you have exhausted everything. You have nothing, no medicines to be tried, no machines to be put to take care of us. Then what? Should we die? Or do we have any other alternative? Now, the answer to that is transplantation, heart transplantation. You change the heart, put someone else's new heart. Now, is this a reality? I'm sure you all must be reading. This is becoming fairly accepted and common in India today. At least last couple of years, 1 or 2 years, it's becoming common. I think we should admire the courage of that person to do this in 1968 in India. You can imagine how this country was and what he was looking at, and that happens to be the 6th transplantation in the entire world. Now, last 2 or 3 years, we have seen that this particular heart transplantation is slowly picking up across the states. Now, it's picked up in Karnataka, it's picked up very well in Kerala, it is picked up in Tamil Nadu, it is picked up in Andhra Pradesh, to some extent Maharashtra. It is also picking up in Delhi. Now, barring these 4 or 5 states, elsewhere we don't see much enthusiasm, mainly because there is lack of knowledge, lack of awareness. Now, imagine a person who is in prime of his life, say you're 30, 35, for various reasons your heart fails and somebody tells you that there's nothing else I can do. Now, how do we feel? You're just sitting and waiting for your death. You know that nothing can be done. Everybody has said wash their hands. There's no other technology to save me. Children who are suffering from heart problem, things were far from what it is today. Couple of months I saw no one. Then I started interacting with the pediatricians, GMC, everybody. What is happening to these children who are born with the heart problems? There is only one place, those who could reach Chennai, Dr. KM Cherian, some survived. 1 or 2 went to KEM, got operated, because I know, being from KEM, where we stand in this aspect of cardiac surgery. Rest were all dying. They never believed that these children can be made normal. Vast majority of them, they can be treated. It required multiple interactions with the doctors. CMEs conducted, multiple press conferences we had. We brought in those patients who had surgery. We shared the experience of the parents. We shared how those kids are doing.